Please be aware that I will be mentioning suicide in this video. As practitioners or family members of someone struggling with chronic suicidality or substance use disorder, how do we avoid burnout when it seems like we are working harder than the person themselves in their own recovery? One way or another, I work with a lot of patients who have been fired, or at least that's their perception, by other practitioners. And the primary reason for this is their unremitting tendency to resist treatment recommendations, especially in regard to suicidality or using substances. Understandably, it's extremely hard for practitioners to watch our patients suffer so intensely, and yet appear to make little change or even fight that change. This is especially true for the patient who constantly seems to be looking towards suicide or a substance as a way out. After a while, the practitioners, and friends and family as well, often give up and they seem to wash their hands of the individual, essentially saying, "I can no longer watch this person I care for self-destruct." Of course, at the other extreme, there are individuals who are going to be there no matter what, even if it means their own potential destruction. And I understand and I feel for both positions, and I don't believe that either is intrinsically right or wrong, even though leaving can seem harsh, while the opposite can be enabling. The thing is, there's a middle ground between staying all in with the individual who's actively fighting change and completely giving up on them. However, this can be a really uncomfortable position for most people for reasons that I'll talk about today. This approach often seems counterintuitive, and it has to be understood this is generally reserved for patients who have struggled for a very long time with self-destructive behaviors and who have not responded to traditional therapy or medication, such as is often the case with borderline personality disorder or chronic substance use disorder. I refer to it as standing by the river but not jumping in. And it's not just an analogy I use when teaching practitioners or family members, but it's one that I speak openly about with my patients themselves, as it can offer a certain amount of insight into their situation and a better understanding of how I see my role in their treatment. I say, imagine you're sitting on the bank of a raging river, and suddenly you notice in the middle of the rapids, somebody you know and care for struggling for their life, barely treading water. So of course, you jump in, you swim through the rapids, you fight the current, you take hold of them, and you pull them to shore, risking your own safety in the process. As clinicians or family members, this is what we do. We pull them out, we dry them off, we send them on their way. And, thankfully, they're now out of danger. Now imagine about an hour later, you're sitting there by the river again, and you see the same person, once again, struggling for their life in the middle of the raging torrent. You might be confused, you might be baffled, but you know what you need to do, and you jump in, already somewhat exhausted, and you pull them to shore. Once again, they head away from the apparent danger, warm and dry. Now, you can imagine that an hour later, when you see the same person once again out in the rapids, you might hesitate. You're now exhausted from the previous rescues. You may even start to become somewhat angry or even resentful. But as caregivers, family members, we do what we need to do, and in we go. By this point, we are exhausted, and it takes everything we can just to get them safely to the shore. Well, there comes a time when most people, due to lack of energy or reserve or feelings of exhaustion and frustration, finally decide that they can no longer brave the river. They've reached the point where they say, "I can no longer stand here and watch you drown." And they walk away from the river altogether. It's natural, it's self-preservation, and it's also true that it's devastatingly hard to watch someone you care for suffer in front of your eyes. The problem is, and I've seen this innumerable times, there often comes a point when the drowning individual finally realizes that they don't want to be in the river, that they are going to have to start working to change the path that keeps leading them back to the river. And once again, they cry out for help. But now there's no one left on the shore. So they desperately begin to swim, and this may be for the very first time. And they swim as hard as they can towards the safety of the land. And this switch represents a change in perspective, a realization or an insight that only comes to many patients from almost drowning. To me, it's the point when the patient truly turns towards recovery itself. So they swim, exhausted from the ordeal, and they get to shore. but they don't quite have the energy or the resilience to pull themselves onto land. And as a result, they drown. So, what is the third alternative to either throwing yourself into the river over and over until either one of you or both of you drown, or walking away out of frustration and sadness, feeling like there's absolutely nothing to be done? The third option is to sit on the shore until the individual either does go under or until they change their mind and start truly fighting for their own life. And at this point, you can stand on the shore, you can be there, you can offer hope and encouragement. You can let them know that if they get close enough, you can throw them a rope or lend them a hand. But you can no longer jump into the river after them. The problem with this third option is it's extremely difficult watching somebody potentially drown and resisting the urge to do anything until they've gotten close enough for you to help them with a final hand. But remember, you've already been in the river over and over, and this has not changed anything. This is the stance that I have adopted with many of my chronically suicidal patients, and it may even seem calloused on the surface. But too many times patients finally make the effort and reach the shore, only to find that there's no one left to pull them out. So I have made a very conscious effort to still be there if and when they do make it within arm's reach. But it can be at times very painful, especially when they never choose to head for shore or when they wait till it's too late. Keep in mind, I'm all for jumping in the first time, maybe the second. And each individual, practitioner, family member has to choose their own tolerance level. But there does reach a point when the behavior continues to repeat itself, when I will not venture into the deep water anymore. But I don't walk away. And more often than not, they do turn towards the shore, and the hand that's there awaiting them makes all the difference in the world. Chronic mental illness, including substance use disorder, can be some of the most difficult conditions, not only to treat, not to mention to suffer with. And I've seen way too many instances of practitioners and family members who have burned out because they can't tolerate their own pain and discomfort when it comes to watching a loved one suffer. But standing and waiting is not doing nothing. It just sometimes feels like that. I'm Dr. Vint Blackburn, and remember, mental health and physical health, they're the same thing.